Welcome back to Navigating Cancer. Again, I'm Dr. Joey Bennett along with Wendy Hall. We both work at the Robert Boisneau Oncology Institute in Lecanto. If you haven't visited our website, please do so, www.rboi.com. We have a lot of important information on the website. We're uploading these shows to the website after we've run them on Key TV. So if you missed an episode or if you want to go back and look at another episode again, please feel free to go to our website and look at the information. A lot of good stuff on the website.
And connect with us on Facebook.
Right. If you're a Facebooker, please connect with us because Wendy does a very good job about putting information on Facebook about any kind of upcoming activities or things that we may have at the office. When we took the break, we were talking about evidence that shows that exercise can help with breast cancer survival. And one final slide that I want to show you, there was a very large analysis of women who had breast cancer, and in this study, about a 24 to 67% reduction in deaths and a 50% reduction in breast cancer recurrence in women who were physically active. And what I mean by this is women who underwent at least 3 hours per week of brisk exercise, like walking, going to the gym, doing those things. 4 to 5 hours a week is even better for you. And this effect can be seen in all women, whether you're premenopausal or postmenopausal. The more you exercise, the better off you are. So please try to push that. Breast cancer is not the only thing, though. On this slide, you can see that colon cancer also has been proven to do better in people who exercise. 51 different studies were looked at in this review, and out of the 51, 43 of them demonstrated that people who were physically active decreased their risk of ever developing colon cancer on an average of about 40 to 50%. Some of the studies showed that it even went up to a 70% reduction in the colon cancer. And it makes sense because people who exercise like this probably tend to eat right. The more you exercise, as I said in the first segment, the more regular your bowel movements are, so the faster these waste products are moving through your intestinal tract. And so it all kind of ties in that you can lower your risk of ever developing it. But it can also help you with survival. If you do 3 hours of exercise of moderate physical activity every single week, if you've been diagnosed with colon cancer, you can cut your risk of dying of colon cancer anywhere from 40 to 60% roughly, and cut your risk of dying from all causes by anywhere from 50 to 60%. So absolutely plenty of evidence out there looking at breast that we've covered now, looking at colon cancer that we've covered, showing that exercise is critical. How much do you exercise a week?
Well, I try to walk at least 5 days a week, but as much as I possibly can. But I think we should start a walking group. We've got a nice path we could do. You're inspiring me.
And we do have some of our employees who will get to work early and they'll walk a little bit in the morning. But I mean, it's try to find the exercise that you like the most. You've got to enjoy it. If you like walking, go walking. If you like to ride a bike, ride a bike. If you like to swim, swimming is a great exercise because it's low impact. If you can do a pool type aerobic, you can really work yourself out without having the impact of pounding on the pavement like runners often do. Let's talk about prostate cancer now. There's plenty of evidence that shows that prostate cancer can be affected as well. It's not as good a data as we have with breast and colon, but it is still very good. It reduces your risk of prostate cancer by about 10 to 30%, and it can also help lower your risk of having what we call BPH, which is benign prostatic hyperplasia, just an overgrowth of the prostate that tends to happen to men as they age, and it can affect your ability to urinate. But the bottom part of this slide also shows you that exercise can lower the severity of the disease and can actually lower the death rate from prostate cancer. So guys, it's time to get out there and do this. A lot of this deals with if you exercise and eat right, your body weight is probably going to be better. The better your body weight is, the more you exercise, the lower your testosterone might be. Now, not to a point to where you're tired and dragging, but low enough to where you don't increase your risk of having prostate cancer. So you really want to get out there and try to push it as much as you can. Do you get your husband to go walk with you?
Absolutely.
Good.
That's new too. That's good news.
Good. Endometrial cancer is another one that we want to discuss. This is uterine cancer. And as I have said in previous shows, there's a strong association sometimes between women who have breast cancer or endometrial cancer potentially getting one of the other cancers. And several studies have now shown that you can lower your risk of developing another type of cancer if you exercise. And with endometrial cancer, again, truly a decrease in your risk of developing the endometrial cancer. And this goes back to really the kind of the same thing we just discussed with men and prostate cancer. The more a woman exercises, the less body fat you're probably going to have, the less estrogen that you have in your system, because fat can be metabolized into estrogen. So all of a sudden, here we go, lowering the risk of breast cancer and lowering the risk of uterine cancer. So, you know, multiple reasons for women to really be out there trying to be active. Next I want to talk about is lung cancer. Believe it or not, there does appear to be a slight reduction, although it is not overwhelming. It does not appear that physical activity can decrease your risk of getting lung cancer. That means you quit smoking if you want to decrease your risk. But analysis have shown that about 13% of people will do better if they are exercising, and maybe even up to 30% of patients doing better if they're really strenuously exercising on a regular basis. So even with lung cancer, there's some proof out there that it can help benefit it. The biggest thing that would help us with lung cancer is just don't smoke. Try to keep kids from picking up on smoking. Finally, as we talk about this, a few other cancers that may be linked, and this again is not proven because there have been some positive studies and some negative studies, but ovarian cancer and testicular cancer would certainly make sense that they might be linked to being active, because these are hormonally driven types of cancers, but also some evidence that maybe with kidney cancer, pancreatic cancer, thyroid cancer, and even potentially melanoma, you can see some improvements in how well people do after they've had their treatment done. So lots of reasons to try to be active, lots of reasons to try to get out there and exercise. Again though, before you do this, make sure you spend some time talking to your primary care physician, taking into account all of your health problems, making sure that there's not a reason that you should not be doing some sort of an exercise program, making sure that you maybe have a bone problem and they want you to do something low impact. So always include your primary care physician, ask them if it's safe for you to exercise, and if it is, get out there and do it. When we're going to come back, we're going to talk about survivors and the benefit of exercise.